Good morning, YouTube family. I am about to put in a little 2 cents as I wash my face because just some things that are on my mind, as well as we winning Wednesday affirmations. We're gonna do that as well, but some things that I have just been thinking about, especially working in the healthcare field, and what I see quite often. If you do not know what medications you take, and you get to the hospital and they ask you and you really don't know, or they ask you and you don't really know the dosages, you don't really know what it's for, yes, they can look it up, but a lot of times, I would say over about 50% of the time, a lot of people do not take the medication as it is prescribed. A lot of times it may be daily and you may take it 7 in the morning, you may take it at night. Or you may take it at if it's 3 times a day, you may take it in the morning, and then you may take it once like later on in the evening, and then another time you take it when you go to bed. We don't know that. We don't know the specific times of how you take it. We don't know any of those things. And a lot of times when you go to the hospital anyway, we have synchronized time frames of when things are given. So, but we still need to know how you take it if you have the pill. Because if you take the whole pill, it makes you feel dizzy or X, Y, and Z, or feel a little bit off. However you take it, that needs to be known. So, so make sure that you write down on a piece of paper your medications that you take at home, the name, the dosage, particularly the dosage, and how you take it at home. Okay, and a lot of times when people do these, mail order pharmacy things, we don't get that. We can't look that up. We don't know that. So that's fine, but you need to have it all written down, and not just your prescriptions. You need to have like your over-the-counter medications, your vitamins, your fish oils, whatever it is that you take, because those things affect your body too, you know. So, you need to have that written down, because, for example, let's say you take blood pressure medicine. You get to the hospital, your blood pressure is in the 170s, 180s, 190s. We don't know what you take. And then if you don't know, then we're going to give you something IV to help get it down. But we're still trying to, figure out what you take. And yes, you can transport it over from the pharmacy. But if you haven't gone to that pharmacy in a while, or you just went to the doctor just changed your meds, your pharmacy is not updated with that information. So we need to know all of that. And if your parents are older and they don't really know, then you need to have a designated person that handles their medications and stays up to date with that information. Because yes, your parents may know about their their everyday life, but medical wise, and how to handle that, and when you've been healthy your whole life, and then you've gotten sick, or your health has deteriorated, or whatever the case may be, how to handle that part of it. And okay, I need to keep up with my medications. I need to keep up with what my doctor is telling me. All of those things, people don't necessarily think about that or do that. So, and then you don't know until you go to the doctor, and they don't really know what they're taking, or they don't really know how they take it, or they don't, and when you're there and all this stuff is going on, that's not really necessarily the easiest thing to think about. So, especially depending on how critical the situation is. So, have written down before you go to the doctor all of your medications, even procedures, because different procedures that you've gotten, then we find out later on, oh, you had a ablation in 2000 and in 2001, okay, that would have been helpful to know, but you didn't think about it. So it's just not necessarily that you don't know, it's just that in that moment you don't necessarily remember every procedure that you possibly have had, and when you get time to sit down and really think about it, oh yeah, I remember this, oh yeah, I remember, oh, I had that done too, oh I forgot, oh I didn't tell you any of that. That's helpful. Okay, so also, if you have insurance, you need to know what your insurance covers. If you are Medicare and Medicaid, so you are older, you need to know what your insurance covers. Particularly, yes, you may have good Medicare and Medicaid, and you don't got to come a lot out of pocket out of your medications. Okay, good. But let's say you break a hip, or you need knee surgery, or you need something like that, and then you have to go to a rehab facility. Well, okay, now you have to go to a rehab facility. And now it's taking them a long time to get you somewhere to stay because your Medicare and your Medicaid is not clearing it as quickly as what you need it to be cleared. So you're having to stay over in the hospital longer to get your strength better. And you can't go to a rehab facility just yet because they're still waiting on your insurance. To clear it. I got all that stuff comes out of my hair there, like it's very annoying. But anyway, so that's my 2 cents as far as what I see in the healthcare with patients that come in, especially if they're older patients in their 50s, 60s, 70s. They're still people. They're still living. They still have a life. So, you know, but they do need help. A lot of times it's hard to get like your family, or especially your parents, and you're the daughter or the son, to get them to listen and to get them to do stuff. I get it, because they're stubborn, they're set in their ways, and they're like, I'm your mama, I'm your daddy. I tell you, and you're like, oh, but you still need to be doing X, Y, and Z as far as your health. So a lot of times it's hard for them to listen. And we get that, right? So, but just saying, like, designate somebody if they're a little bit stubborn to handle their affairs. That makes it a little bit easier. Or maybe even 2 people, because honestly, the one person, they get exhausted, they get tired, they need a break. So, you know, have an extra person to kind of be that liaison to kind of offset it when that other person's not available, or they just need to kind of need some me time, need some you, not some family, but just some me time. That's all. So, they need that. They do get exhausted. Like double cleansing. I wash my face beforehand, and then I use the Melaleuca this stuff again for afterwards. And then I'm gonna use my handy dandy Sea Breeze and see how much dirt is on the towel. I don't know if this is weird, but I like to clean my face and see how much dirt is left over. So that way I feel like my face is clean. Because otherwise I'm just like, are you clean legit though? It's like when you take a bath and you clutch, you take a bathtub and you see the ring in the tub. It's like, okay, I'm clean. So, but anywho, so there's that. That's my little 2 cents as far as healthcare is concerned and what I see when I get to the hospital. And I'll let you guys know some more. But the biggest thing is know your insurance and know your medications. A lot of people, they don't know their medications. They don't know what they're for. They don't know what they do. They're just like, that's what my doctor gave to me. Or he gave me something. It's the L word. It's that heart medicine. It's one of them heart medicines on there. You take about 3 different heart medicines, bro. Just saying. Take about 3 different ones. Oh, that one. I think that one's it. We need to know. We need to know. Not to get out. Anyway, let's get started into our Wednesday. We winning Wednesday affirmations. Let's get started into that. So, I am blessed.